Hi, I'm Dr. Iva LLoyd, President of the World Naturopathic Federation. I would like to thank Anthu, our full member from Uruguay, for asking me to be part of the opening of the 4th Hispanic American Meeting of Naturopathy. It is wonderful to have naturopaths and naturopathic associations from 23 countries get together to celebrate and provide updates on naturopathic practice in their countries. The theme, naturopathy, now more than ever, is such a fitting theme. There are so many concepts in naturopathy, such as prevention, self-responsibility, healthy living, that are core to naturopathy that are now being recognized in other systems of medicine as so important. The time and the importance of naturopathy to take its place in healthcare is now. The WNF takes the role of supporting the growth and diversity of naturopathy seriously. We were formed in 2015, and we currently have 34 full members and 20 educational members spanning all world regions, representing both naturopaths and naturopathic doctors. Moving forward, our focus is on increasing membership in Latin America and in Europe. When the WNF first started, our initial goal was to get a sense of the landscape of the naturopathic profession around the world. We did this by starting with a survey in 2015, where we asked the profession what they did. We received responses from a number of different countries and world regions. We followed that up in 2016, asking the naturopathic educational institutes what they taught. What we found from those two surveys was a much higher degree of consistency than we ever imagined. This allowed the WNF to create 2 documents. The first one was a 2.5-page document saying this is how we define the global naturopathic profession. This is something that we were asked for by the WHO, and we've been asked for by other governments to say, how do you define the profession? So we did that. The second one was a 100-page document, which is a white paper on naturopathic philosophies, principles, and theories, which really is the foundational basis of the naturopathic profession. The next thing that we looked at is what is the true educational and regulational status of the naturopathic profession around the world. After a lot of analysis and working with the naturopathic organizations, we created a document in 2018 looking at the correlation between education and credentials. We are now in the process of doing a further analysis of educational institutes, naturopathic educational institutes, to really have an understanding and to help give them feedback on the global naturopathic educational programs around the world. In 2019, we published a document looking at the global naturopathic regulation, which outlines the 13 countries around the world that are regulated, what their scope is, what their education is. This is a wonderful document as a foundational basis when you're working with governments looking at getting regulated or recognized in your country. One of the things that the naturopathic profession has always been asked for, and that we from the WNF are continuously asked for, is in what way is the naturopathic practice evidence informed? In order to answer that question, we've done a number of things. The first is looking at a listing of books written by naturopathic practitioners. We currently have over 1,500 books that are listed. This is updated yearly. We also looked at the research done by naturopathic researchers. There was a perception that there wasn't a lot of it, where actually the naturopathic profession is very research-based. There's over 2,500 articles that we know of that have been written by naturopathic researchers and that are indexed. The publication of this document, which will happen in September, will help change the perception of the amount of research and support backing the naturopathic profession. The other thing that we did is we did an international practice survey. 13 countries participated, and we had practitioners follow their patients consecutively, and to determine what practitioners actually did in practice. The results of this survey confirmed what we had seen in the other surveys as well. One, that the naturopathic profession is very eclectic, that there are key modalities such as clinical nutrition, lifestyle counseling, herbal medicine, hydrotherapy, some form of body work that is used pretty much by all practitioners around the world, and that the naturopathic practitioners treat a broad range of patients. So this is a document, or this has been published, and this will help educate the rest of the world as to what the naturopathic practice is actually like. Currently, we're looking at analysis of peer-reviewed naturopathic articles, which will give us also more information on how naturopathic practice is informed. So these are articles written by journals that highlight articles written by naturopathic practitioners or by journals, peer-reviewed journals done by naturopathic organizations. So we believe there's over 10,000 naturopathic peer-reviewed articles out there that help inform naturopathic practice. Coming this September, we're going to be doing a survey which is called on knowledge mobilization. And this will take a look at how naturopathic practitioners apply inflammation in practice. So not only research information, but what the patient tells them and how they integrate all of this in their treatment approach. So we expect that the results of this survey will really help highlight the important role that naturopathic doctors play in working with the patient in determining the treatment plan. All of the information that we've done in all the surveys have created a foundation which will help the WNF do a health technology assessment. This will be probably the most important document that the WNF will do. It will end up being about a 250 to 300 page textbook, which is for governments predominantly and policymakers, which will really help define what the naturopathic profession is. What is key about the health technology assessment is that you can only use research that has been done by your profession. And that's one of the reasons why we've done so much research lately. But we also want to recognize that the naturopathic research community has been extremely active, especially in the last 30 years. So we're in a very, very good position to create a document that will be foundational for anybody who's looking at working with government. So we expect that the draft for the health technology assessment will be done by the end of this year, and that we will be publishing it officially first quarter, second quarter of next year. One of the other things that's really important as a profession is your role in community engagement and how you help the public become healthier, not only your patients but the general public. So there's a couple things that we did. The WNF did a survey looking at the number of community clinics around the world, and we estimate there's about 100 naturopathic community clinics or community clinics that provide naturopathic care. What makes it a community clinic are the clinics that provide care that is either free or minimal cost to specialized groups, underprivileged people, low income, those sort of things. So this we're about to publish, and this will be published the end of September or October, which really highlights the important role that the naturopathic profession plays in communities in helping with healthcare. We also did a survey asking naturopathic practitioners as to how they educate the public. The survey we did in July, and it was fabulous because we had over 1,000 responses from naturopathic practitioners around the world. And it really helped us clarify that the naturopathic professionals are very active in educating their communities by doing blogs and newsletters and talks to the community on how to live a healthy lifestyle. The other things that the WNF has done is we've done an animated video that describes how to build a shield of wellness to protect you. The video was translated into 4 languages, and that is available for naturopaths and naturopathic organizations to use as well. We're in the process of doing a similar video to educate people about how to protect themselves from environmental toxins. The WNF has done a website on antimicrobial resistance to be used by the naturopathic community onto how to educate people about the role of naturopathic care to prevent antimicrobial resistance or treating those that have been affected by it. We're in the progress of doing a similar one on environmental pollutants. One of the other things that the WNF has been very active in is our social media. We follow all WNF members and we repost their messages. But we also post things that they can post to, such as the animated video and other things to help educate people about the importance of naturopathy with respect to healthcare. With respect to WHO engagement, members from the WNF meet yearly with the head of traditional, complementary, and integrative medicine at the WHO. I have participated as the president of the WNF in 4 working group meetings, one on acupuncture, one on cupping, yoga, and anthroposophic medicine. We attended the Global Conference on Primary Health Care. We were one of only 2 traditional complementary systems of medicine that did so. So the WNF and the naturopathic profession is getting international involvement in healthcare, and we take every opportunity we can to promote the role of naturopathy and the importance of naturopathy in global healthcare. When COVID hit earlier this year, the WNF response was to really educate members as to what this meant for us. So we did some updates on it. We were invited to a WHO meeting on March 30th to discuss the role of traditional complementary medicine in the management of COVID. As a result of that meeting, we were asked to do rapid reviews or research to really come to the table in a research-based way to say what research is there to support how we can treat. So we've done that. So we are in the process of publishing 10 rapid reviews. They will be published the end of August, the beginning of September. So by the time of this meeting, they should be published. And we were able to do that with the help of 9 naturopathic educational institutes, a team of 40 naturopathic researchers, practitioners, and content experts from 7 countries and 5 WHO world regions. Rapid reviews will be published individually, but there will also be a special edition in the Journal of Advances in Integrative Medicine that will include all the rapid reviews in one edition. We're in the process of doing briefing notes for governments, where WNF members will be able to use this in going to the government to say, this is how the naturopathic profession can help in this global healthcare crisis. So yes, naturopathy more than ever is ready to become a significant player in global healthcare. The WNF has been able to do this work because of the support and dedication of our members and the global naturopathic research community. We thank all of our WNF members and encourage those naturopathic organizations that are not yet members to join. I really do wish you a great 4th Hispanic American meeting of naturopathy. And if you have any questions or if the WNF can help in any way, please let us know. All the best, and I hope next year to see you in person.